And here's a little bit of differences between a patch, and a pill, a cream, an injection, and a pellet. And one of the main differences is that, Dr. Huang, you were talking about oral has to go through what we call the first bypass, right? It has to go through the liver and digestive tract to be absorbed. And that's where we've seen some issues. With a patch or a cream, when it goes on the skin, if you think about it, skin is meant as a barrier. And what we have seen clinically is approximately 45% of people that don't absorb adequate levels. So you're paying this money, sometimes very expensive, for these creams or gels or patches that when you get your blood drawn or see where your levels are at, there is hardly anything there that is not giving you anything for, benefit, not to a level that is beneficial. So for an implant or a pellet, what the cool thing is about that is there's a constant steady state. If you think about it, when we are taking a pill, we're doing it once a day. If you're doing a cream, you should be doing it twice a day. If you're doing a patch, that's a little bit better. You're doing it maybe every 3 days, but you're still getting hormone and then not, getting hormone and then not. It's a roller coaster. The cool thing about a pellet is that when it is placed just in the fatty tissue of your skin, capillaries form around it. And how we originally have hormones going through our bloodstream is by cardiac output. So if we are stressed out, no one's stressed, right? Working out, fight or flight situation, heart rate races, tells pituitary in the brain for ovaries or testes to literally spray hormone into our bloodstream. As we age, we have poor sprayers. We don't have the levels anymore. Ovaries and testes just stop working as well. But when that pellet is in the fatty tissue, capillaries are there, and your heart rate increases, it goes by absorbing more as you need more. But when you're resting, that blood flow slows down as you don't need as much when you're resting, but it's on demand to your body. So you have this constant steady state versus a roller coaster effect. And the other cool thing about the pellets is that they are, of course, human identical. They're plant derived. It's on demand to the body. There's no fillers. It is not time released. A time released is an injection, which has fillers, which are oils that can have allergic reactions to, and that still has to go to the liver to cleave off to be able to use the right hormone. Pellets have been around since 1939. They've been studied and used in over 5 different continents around the world. They're one of the most studied, most efficacious forms of delivering hormones. Most people do them 2 to 4 times a year instead of 2 times a day. And the dosing is individualized. And that's what's so important when we are teaching and talking to our providers. We're talking about how do we individualize each person's therapy. And too many times, I believe that prescriptions are more of a one size fits all, or there might be 3 different prescriptions, but everyone starts at the same dose, and that just doesn't work. So it's safe, it's hassle-free, and you don't even know